If you can give me the next 4 minutes, I'll show you how this breakthrough in medicine is helping my patients here in Quincy and surrounding areas recover from years of chronic pain in their knees, hips, shoulders, and other joints. And no, it does not involve addictive pain medications or risky surgeries. So if you're dealing with the aftermath of an accident, an injury, or any other trauma, listen up closely. This may be the most important information you've ever heard when it comes to your health and overall quality of life. Because after helping thousands of patients over the years, I have never seen these kinds of results that we're finding. And certainly not as quickly as I'm seeing with this new therapy. Patients like Steve, whose wife encouraged him to come and see me and ended up completely turning things around just after 6 weeks. With absolutely no downtime, in just his second month, Steve told me he felt like he had gained a couple years on his life. And this therapy, the same one I use with Steve, works in much the same way as a farmer preparing his land in the early spring before planting his seed. Now, after I share exactly how this new therapy works, I'm going to show you where you should schedule some time on my calendar to see if regenerative medicine is right for you. So let me ask you this, have you ever heard of PRP or platelet-rich plasma? What about angiogenesis? No? With platelet-rich plasma or PRP, what we do is we draw your blood into a tube. That tube is put into a centrifuge that spins that blood around really fast. And what happens is the plasma or the rich part of your blood comes to the surface of that tube, much like rich oil comes to the surface of water. The rich part of your blood, or the plasma, is a golden color. It actually is liquid gold, or the most healing properties of your blood. And once we've separated out that liquid gold or the plasma, we're going to put that PRP directly into that joint that's been bothering you with an ultrasound. So we are not guessing where that basically PRP is going, it's going directly into that joint that's troubling you. Say your knee, maybe your hip, or even your shoulder, or wherever you're experiencing that most pain. And what that does is when we put that liquid gold or PRP directly into the joint, it triggers something called angiogenesis, which is the creation of new blood cells. So just like when that farmer tills up the ground, bringing up all those nutrients to the surface of the earth, preparing the ground for the seed that they're about to plant, after we've sufficiently added that PRP and we have that joint all the nutrients it needs, now it's time to add the seed. Have you ever heard of HCTPs or maybe human cellular tissue product? Maybe you've heard the term stem cells. Excellent. So stem cells are harvested from the umbilical cord post-birth by a state-of-the-art lab. That lab ships the cells in a vial, and then we are able to put that cell into your knee, your hip, your joints, any shoulder, anything again that's bothering you or troubling you. Stem cells are like the seed in our example that farmer has been preparing to plant. And because we've cultivated a nutrient-rich environment with those PRP injections, what we've discovered or what we have found with patients is groundbreaking. We have found that shown that quite literally helps to regrow or regenerate that joint. It's why you take some blood from your arm and spin that in a centrifuge to give you that platelet-rich plasma we need, that liquid gold, to cultivate a nutrient-rich environment. So that way we can ultimately deposit the stem cell into the problem area. So we give the joint everything it needs to renew itself. And lastly, what we're going to do is do some rehab on the top of that. The rehab is like fertilizer in our example, and it is vital to have an optimal joint regenerate. Much like fertilizer allows that seed to grow into that plant that it was meant to be, we want to give your body every opportunity and every resource it needs to heal itself. So let me ask you this. What would it be worth to you to turn back the clock, to gain a few years back on your step, to get rid of the pain once and for all? Would it be worth 30 minutes of your time to see if you're a candidate for the treatment I just described? Click the button below of this video and book a time on my calendar. We'll dive into all your questions, but more importantly, we'll put together a custom plan to see if regenerative medicine is right for you. You won't need to suffer any longer. Just click the button below, schedule a time, and let's turn back the clock. I look forward to seeing you here in my office. Dr. J has always had your back, but now I have your hips, knees, shoulders, toes, and any other joint in your body. Thank you.